And if you're watching on YouTube, please subscribe to the TRF channel. It lets YouTube know that you think this content is valuable, and then they'll show it to more people. We're so happy to have you with us for Trauma 101 with Linda Tai. Today's session is Fawning and Appeasement, Reactive, Proactive, Acute, and Chronic Relational Survival Responses. It's my very great pleasure to introduce you to our presenter. Linda Tai is a trauma therapist who specializes in cutting-edge brain and body-based modalities for the healing of complex developmental trauma. As an educator and consultant, she is gifted with the capacity to contextualize, synthesize, and communicate complex and nuanced issues pertaining to the impact of oppressive systems upon identity, mental health, and well-being, and the invisibilized wounds of racial trauma. Linda is passionate about breaking the cycle of historical and intergenerational trauma at the individual and community levels, and deeply believes in the healing power of coming together in community to grieve. Born in Vietnam, raised in Australia, and now living in Alaska, Linda is a former child refugee who is not only redefining what it means to be Vietnamese, to be Australian, and to be United Statesian, she is redefining what it means to be wounded and whole and a healer. Thanks so much for being here, Linda. Take it away.
Thank you, Mary, and thank you to the team at TRF for such a wonderful, warm welcome this week. And thank you to all of us in the Zoom space, in the YouTube space. Your interest in this work is what keeps me stepping into the fear of having a voice. Yeah. You know, I know that for us as trauma survivors, being seen and being heard and being known can feel terrifying, because being small, being quiet, and being invisible is how some of us manage to survive. And so I'm going to invite us all to attune towards our communal space together by, let's see here, we're just going to repeat. We learned through repetition some of the things we learned last week in terms of orienting to your space. And for those of you who are curious, when you turn your head from side to side, you engage the phrenic nerve, which goes through cervical vertebrae 3, 4, and 5. And the phrenic nerve connects to the diaphragm and innervates the diaphragm, meaning it moves the diaphragm. So when we turn our heads from side to side, you may perhaps notice breath emerging. Perhaps you may wish to look towards your exits and notice the route between you and your exits. To have a look out your window, or perhaps through your imaginary window towards the horizon or the imaginary horizon. Notice the space behind you. And actually look at something that is behind you. And twisting the torso in the other direction, looking behind. Allowing something to catch your gaze that lands as familiar for the nervous system. Coming back through center and noticing the spaciousness above you, above the head, and the space in front and below. Perhaps an object that you squeeze and pass from one hand to the other. Perhaps some gentle rocking, gentle swaying, perhaps some sound. Humming, sighing. If you like, I invite you to reach your hands somewhere around shoulder height, perhaps above your head, perhaps doing a little wrist dance, perhaps doing a little elbow dance, perhaps a little shoulder dance, perhaps dancing through the torso. Making any sounds that your body would like to release in this moment. And then if you like, a gesture of self-contact, whether it's, actually, let's try this one. The hand under the armpit and the other hand wrapped across the other side. And notice what emerges for you. Perhaps the hand that's wrapped across the other side would like to hold the side of the head. And just notice what this is like for you. These gestures of self-contact, self-holding can bring a sense of containment, as well as perhaps a sense of comfort. And I preload this conversation with this movement and this containment because the content for today's presentation can perhaps be a little bit evocative for some of us. And so we'll pace it, and I'll also offer some moments for pause and for taking care of your nervous system in such a way that allows for us to be able to integrate the information that I share with you. So today we will look at fawning and appeasement as well as the dorsal vagal response, and we'll actually create some distinctions that I hope will allow for some nuance in amongst the complexity of all of these as survival responses that can be categorized as reactive, proactive, acute, as well as chronic ways of being in relationship to ourselves as well as the world around us. And so last week, we looked at the neuroception of life, threat, and danger, and these animal defenses that arise. And if we continue from last week, we can pause and land into perhaps a more holistic approach to conceptualizing trauma. This here, the graph around neuroception of life, threat, and danger, our animal defenses, very much hyperfocuses on acute reactions in the moment. And yet, a more holistic approach to conceptualizing trauma requires that we pause and consider that trauma can also be framed, traumatic stress can also be framed as too much, too sudden, or too little of something for too long or for not long enough, especially when it comes to resources, not long enough. Yeah. So too sudden, too much, too little of something for too long or not long enough without adequate time, space, permission, protection, and resources or resourcing in order for the nervous system to return to homeostasis. And as a result of this, there is a trauma survival response that gets stuck in the nervous system. And as Resmaa Menakem says, trauma that's decontextualized in an individual can look like personality. And trauma that's decontextualized in a family can look like family traits, and trauma that's decontextualized in a people's can look like culture. And so if we just pause here and go, the frame gets bigger. And I believe as a social worker that we tend to micro the macro. We tend to pathologize or stigmatize the individual based on the individual's inability to cope. with what is going on in the external environment, rather than recognizing that there is a mismatch between what the individual needs in order to thrive and what the meso and macro environment and the chronological environment historically has been able to offer the individual and their family and their peoples. This expanded definition also speaks into trauma as what happened that shouldn't have happened, but it also speaks into what didn't happen that should have happened. Yeah, big deep breath. And then based upon this framework, we can actually then begin to become curious about the ways in which psychology and psychotherapy has referred to traumatic stress. So traditional psychology says, what's wrong with you? Trauma-informed psychology says, what happened to you? Culturally informed psychology says, what happened to your people? And liberation psychology says, and what continues to happen to you and to your people. And so this is where Resmaa Menakem says that post-traumatic stress disorder is a misnomer. Post suggests that it's in the past. But for many of us, it's not in the past. It's present and pervasive and institutional or institutionalized and systemic. And it's historical and intergenerational. And so this is where healing is political, because politics decides who has access to time, space, permission, protection, and resources in order for the nervous system, the collective nervous system, to return to homeostasis. And so for many of us, it's not collective trauma, it's collected trauma. Similarly, for many of us, it's not collective grief, it's collected grief. It's been a bioaccumulation, of too much of, too sudden of, too little of, for too long or not long enough, across multiple generations. And to pause into the expansiveness of this, can be a lot. And so into this space, I'm going to invite some gentle rocking, if that feels okay with you, as well as orienting to the 4 directions. And we can also include the 6 directions up above and the ground beneath us. And then the 7th direction, here. And then an invitation to scrunch your face, to move your body, to make some noise, to release through your joints. And you can choose here. This may be enough for you for today. And in which case, thank you for listening to your nervous system. You can always return to this recording. It will be available on YouTube. And if there is the capacity in your nervous system, we can move on to the next piece about trauma, where I'll expand conceptually some aspects about trauma responses that can, I hope, offer some forward movement. So in social media, I often see trauma responses as fight, flight, freeze, and fawn. And as a somatic therapist, I look at trauma responses as the attachment cry, flight, fight, high freeze, and then flop or feign death. Yeah. The dorsal vagal shutdown. And so through this slide, I hope to unpack for you the distinction between fawning, appeasement, and dorsal. Knowing that I'm not right, I'm not the expert. These are simply definitions that I've come up with through the work that I've done, as well as drawing upon the work of other people. And if it's helpful for you, then you're welcome to anchor into this to help make sense of your me search, what's happening for you in your nervous system. Yeah. And whatever doesn't work for you, you can put aside for now. So the dorsal shutdown response, this is the flaccid immobility. You can YouTube for possums that have been under threat by humans or dogs or coyotes, and you'll see their body and their nervous systems going into the flaccid immobility response. Fawning, I'll pause there, and that flaccid immobility response is resource conservation. It's if I become flaccidly immobile, then maybe the predator will lose interest in me and imminent death will be less unpleasant for me, yeah, if that is what occurs next. Whereas fawning, I describe it as the neuroception of relational threat. Examples of relational threat can be the neuroception, the spidey sixth sense in my nervous system, that in this moment, in the communal field, there's judgment, criticism, rejection, abandonment, shame. And rather than experience these intolerable experiences, I engage in an adaptive strategy outside of my conscious awareness in order to maintain the relationship, in order to survive. It's a proactive response to prevent further life threat and danger. And it can look like codependence, compliance, people-pleasing. I give up my identity. I give up my authenticity in order to not be further rejected, criticized, judged, abandoned, shamed, or to feel shame. I say yes when I mean no. I say no when I mean yes. Whatever you want, I want, because that keeps me safe. Yeah, I give up my authenticity. And what this is, it's an attempt to find safety through managing the nervous system of the other person, the predator or the threatening person, or the person who's in an authority figure position. Yeah. And so my nervous system has overlearned, in order to survive, to be whoever the other person needs me to be in this moment. Whenever I experience that threat of the loss of the relationship. And it can look like personality. And what I want you to know is that fawning can be your survival superpower. And what this means for many of us who identify as highly sensitive is that I can walk through a room and my nervous system automatically hyper-orients to any pain that's in the space and to tend to the nervous system that's experiencing that pain. To tend to that nervous system, to extend care, to extend help, to soothe, to ground that nervous system. Because that is how I learn to survive. If I take care of this nervous system, my nervous system will be okay. And so the whiff of the sniff that someone's nervous system may be about to experience pain, I'm there. I'm there. Appeasement. And here I draw on the work of Nedefo. It's the neuroception of a survival threat, a survival threat within an institutionally and societally upheld power hierarchy. And the example that she gives is a Black man in front of a police officer, where in that moment, in order to survive, it's a reactive strategy to self-snuff any life force energy whatsoever in this moment that may be misinterpreted by the other person who is in this position of ultimate authority over my life. And I need to be conscious while self-snuffing that life force energy. Yeah. So I want to pause on that, because the first societally upheld power structure is the family dynamic. So for many of us, we learned appeasement, how to self-snuff my life force energy within a family dynamic where there may have been an abusive or rageaholic parent, where any perception of life force energy in my nervous system will cause for the parent to further escalate. And in that way, I'm actually tending to taking care of your nervous system, hyper-orienting and hyper-attuning to your nervous system so that I can survive. And so the two can become overcoupled. Mm-hmm. Yeah, good breath, good rocking. Mm-hmm. Yeah, self-contact. Mm-hmm. It's been my experience that those who fawn, who give up their authenticity in order to maintain the relationship, have a history, whether it's a singular event or multiple events, of appeasement within the family structure, the family dynamic. And appeasement is incredibly metabolically taxing. And so in many cases, appeasement, because of the nature of the power dynamic and how it's so metabolically taxing, and we're self-snuffing that life force energy, we're self-snuffing our own sense of dignity. And so it can be soul destroying. And so rather than experience that metabolic taxing ever again, we go to fawning so that we don't have to appease. And so this is where fawning can be that adaptive survival superpower, so that we don't have to experience appeasement in our nervous systems again. So I just want to pause on that and allow a few breaths here, because I know that many of us feel a sense of shame around the label of codependence. It's your survival superpower. Now, in terms of the example that NCAM offers, right, the institutionalized and societally upheld power hierarchy, where there may or may not have been experiences of this in childhood, and yet in service or survival, the nervous system knows this is what I got to do in order to survive. By naming this, we can tend to this. And NCAM says the cure for appeasement is dismantling power structures, and no amount of nervous system regulation will do that. Power structures won't dismantle themselves. People need to do that work. Regulating our stress responses whenever we feel more safe is important though, in that it helps us build capacity for the long haul work of liberation. I know the playing field just got bigger in terms of a more holistic recognition of traumatic stress. And yet, to offer some nuance into this space, what Encam refers to here in her definition of appeasement is the offering of appeasement as an acute reactive response in the moment. And yet, what happens when it's within an ongoing relationship of domination and subordination, when it's in an ongoing chronic relationship where there's fear and terror of traumatic entrapment. And this is where I want to offer a content warning before we move ahead around domestic violence, ongoing child sexual abuse, human trafficking, and survivors of domestic violence. And this is where you can choose to orient away from the screen and towards the screen. Yeah, you can engage in some of these somatic resources that I've offered. Yeah. You can also turn the volume down and the volume up. You can also choose to have the volume off. Yeah. And I'll actually stop the screen share so that I'm large on the screen. And when you notice me doing this, yeah, this will be the indication that I've stopped sharing about the highly traumatic content. Yeah, that can be a lot for some of us to listen to. Mm-hmm. Yeah. So, ongoing relationships of traumatic entrapment. These are my clients who are experiencing a multi-year or have experienced a multi-year or are experiencing a multi-year or multi-decade experience of sexual abuse that may have started in childhood or happened in childhood. These are my clients who've experienced being trafficked, particularly sex trafficking. You know, drugs we can sell once, humans we can sell over and over and over again. These are my clients who've experienced ongoing domestic violence within the home. And what I've noticed for my clients, what happens for their nervous systems within these environments is that their nervous systems learn to hyper attune to the nervous system of the other person. And it can look like, and I'll offer some examples which are an amalgamation of client histories over time. I learned how to make the exact sound of pain that would satiate something in my abuser that would then make the abuse stop. I learned to make the sounds of pleasure that would satiate something in my abuser that would then make the abuse over more quickly. It's the young woman who, after her IFS therapy, wrote a blog about being sex trafficked as a child, who said, a part of me learned to be able to pick something in a certain number of the buyers. And if I could tell that there was any sort of fence sitting or any sort of the buyer feeling bad about what they were about to do next in terms of purchasing sex from a child that's in single digit age, that part of me would take over and I would talk about being a naughty little girl, because this would then make the experience less unpleasant for the buyer and make the experience over more quickly. And so within these long-term relationships, we develop adaptive ways to make the abuse less bad and over more quickly by hyper-attuning to and attending to the nervous system of the abuser. And yet you so intimately hyper-orient to the needs, wants, and desires of the abuser so that you can stay alive. But in the process, you lose yourself. And a part of you blames yourself for your complicity in the abuse. And so this is where being able to name this as parts allows for some nuance in terms of the possibility, the capacity for some self-kindness, self-gentleness, self-understanding, perhaps some self-acceptance, perhaps some self-compassion as something that may be possible at some point down the track. Yeah. And then I want to plant the seed for something that is outside of the scope for today, which is what happens when these dynamics of traumatic entrapment happen at the group level. Patriarchy, racism, heterosexism, cisgenderism. But I'm going to name that and table that for today. And then for those of you who stepped away, I'm just going to invite us back. And then in terms of being able to tend to the individual and the collective space, if it feels like it would be resourcing for you, I'm going to invite you to scrunch your face and then release. And then if you like, to scrunch your face and to make a sound of yuck. Yeah. Because what I shared with the group was kind of yuck. Yeah. And what we do is we override. Yeah. That's how we survive. We override. And so to offer a little bit of space for some of that to come out. Yeah. So if you like, scrunch the face, scrunch the body. And notice what naturally emerges for you. For me, it was rocking. For you, it may be something else. It may be orienting. Yeah. Yeah. Perhaps some self-contact. And then if you like, I'm going to invite us all back into the communal space together and invite Pat to come and join us to field some questions, as well as Mary.
Hello. I have one, well, anyone who has a question, feel free to drop it in the chat, but I have one for myself here. Why do you think putting like specific language to some of the things you were talking about, like fawning, appeasement, is important, and what do you think it can help people to do?
What I think it can help people to do is, for many of us, the trauma is the trauma, and a significant part of the trauma is that there was no one there for us to help us make sense of things afterwards. Yeah. And this is where the role of therapists, coaches, blog posts, psychoeducation, TRF Tuesdays can step into that void of that missing experience of someone being there to help create distinctions that allow you to go, oh, there isn't something wrong with me. This makes sense now. I'm able to conceptualize myself within a framework that helps me to feel not so confused, because that existential confusion many of us have had to live with for such a long time, and we adapt our way out of that by finding the answer for ourselves. And yet this piece around trauma education, I feel, is we're not so aware of it out there. And this piece can help to, create a more nuanced path forward in amongst the complexity of this field.
That's a good answer. I don't see any questions, but there's some chat going on about how autoimmune diseases and things like that may be related to trauma, and they're talking about the study, a study that Kaiser Permanente did. Do you want to comment? Do you have anything to add to that conversation that's going on?
Absolutely. If you look up in Google Scholar for research articles around trauma and autoimmune disease, you will have a whole, at least months worth of research to look through. Yeah, because, and keep in mind, I'm not a medical professional. However, I frame trauma as the inability to take effective action. I want to, but I can't. I want to, but I can't. My foot is on the gas pedal and the brake pedal at the same time. Yeah. And so there's an internal tension that then happens in the body, in all the various systems of the body, that then gives rise to an increased likelihood for fibromyalgia, arthritis, autoimmune diseases, urinary tract infections, tension, migraines and headaches, asthma. Yeah, that's the research I'm aware of off the top of my head. Mm-hmm. Yeah.
We are about out of time. There's one little question here. Maybe we could do it for a minute or so. Does dorsal shutdown also show up as isolation, like not fitting in with others?
So dorsal shutdown is an acute response that happens in the moment where I go ragdoll. Yeah. So look up opossum videos, like possum being attacked by a coyote, and you'll see yeah. And so what can happen for many of us as an adaptive response to not ever experience that ever again, I stay in hyper arousal. I stay in go, stay busy. I will conquer this. I will get away. I will make it happen, because the feeling of defeat, despair, and futility and hopelessness and helplessness and powerlessness, I don't want to feel this ever again. Yeah. So I go to the opposite. And then for others of us, we do that for so long that the body says no. Yeah. And now I start feeling like I'm in limp home mode, yeah, all the time. And so then I begin to isolate as my proactive, adaptive strategy to protect my precious life force energy.
Linda, thank you. There's been so many powerful awarenesses and distinctions, and we really appreciate you. Thank you so much to our audience. We're so happy to have you here, whether you're new or you've been a part of our community for a while now. You'll find past sessions of this series and any other TRF Tuesday on our website. Look under the resources tab. Behind the scenes, thanks to TRF staff members, Pat Murray, Star Mohammed, Connor McCann. I'm Mary Frangie, and we will see you next time for session 3. See you then.